Good morning, everyone. Minister Shandro will say a few words and then take questions.
Thank you, Michelle. And good morning, everyone. Last month, our government announced plans for a phased reopening of businesses and services in Alberta. We followed the evidence in imposing restrictions, and we're going to follow the evidence in lifting them as well. And the reality is that we here in Alberta have flattened the curve. Our number of active cases here in Alberta is low and falling. The number of people in hospital is a tiny fraction of what we were prepared for, and our hospitals are safe with almost no transmission of the virus to staff, doctors, or patients. On the other hand, the restrictions have a tremendous cost. The cost to businesses, the cost to their employees, and that is obvious, I think, to all Albertans. But we also need to think about the cost to patients from restricting health care. People need care. They were already waiting too long for a lot of the scheduled care before the pandemic. And what worries me even more is that some people may have avoided or delayed coming in when they needed urgent or emergency care. God forbid someone had chest pain or unexplained headaches in the past couple of months, and they were too scared to call 911 or to see their doctor or earn some or come to the emerge. And they didn't get the care that they needed in time. Now, it's happened in other places. It's probably happening here in Alberta, and we need to avoid it happening anymore. We made the right decisions based on the evidence, and I'm incredibly proud of the health system and the way that all of our health professionals in the province have responded to the pandemic. But it's time to get the system working again and show people that healthcare is safe. Most of all, we've gone through the pandemic so far because Albertans have done an amazing job of following the guidance of our Chief Medical Officer of Health, Dr. Dina Hinshaw. Now, we recognize that as the province relaunches and we all adapt to our new normal, we all may sometimes find ourselves in situations where physical distancing may not be possible. And, for example, riding transit in the province or shopping, maybe situations where it may be difficult to maintain 2 meters between people at all times. Now, in these situations, the Chief Medical Officer of Health recommends wearing a non-medical or homemade face mask. And this helps provide an extra level of protection for everybody. Now, wearing a homemade mask or non-medical mask in public is another tool to help prevent the spread of COVID-19 here in Alberta. Mask use is not mandatory, but we would like Albertans to have the option of wearing a mask if they choose. To give everyone that option, our government has ordered 20 million non-medical masks for distribution to Albertans. They've arrived and are being prepared for distribution beginning in early June. The masks are 3-layer non-medical face masks with ear loops intended to filter germs and pollution particles. These non-medical masks are not personal protective equipment. They're not part of the supply of PPE for our healthcare workers and our first responders, just to be clear. But Albertans will be eligible for 4 masks per person. And I actually have a package here and what it will look like for people when they're able to pick these up. So there'll be a package where people will be able to get 4 of these non-medical masks available to them. Now, to assist us with the distribution, we've partnered with A&W, McDonald's Canada, and Tim Hortons. The masks will be free of charge to Albertans, and no purchase will be necessary to be able to obtain them. These restaurants have generously volunteered to distribute the masks at their drive-through locations across Alberta. There are nearly 600 partner drive-thrus in our province. 95% of Albertans live within 10 kilometers of one of these 600. Now, using the drive-thrus for distribution also ensures physical distancing can be maintained because people stay in their vehicles when picking up the masks. For these reasons, masks will only be available at the drive-thrus. Masks can not always be picked up inside the restaurants or at locations without a drive-thru. We're also working out alternatives for communities that don't have easy access to a drive-thru, including small municipalities or Indigenous communities in Alberta, Métis settlements, and local agencies. So even if you don't have an A&W, a McDonald's or a Tim Hortons in your community, you'll be able to get your 4 masks. Now, I want to thank A&W, McDonald's Canada, and Tim Hortons, and all of the organizations and municipalities who have come together to help us distribute the masks. The collective response from leaders in the public and private sectors in our province has been overwhelming, and I'm grateful to everyone who's been involved. Now, we're shipping masks to our partner restaurants as we speak, and we'll have more details to share, including the official distribution launch date, once everything is in place and ready to go. We're also finalizing a distribution plan to target higher risk areas, such as transit and places of worship where physical distancing is going to be more difficult for Albertans. More details will be available in the next few weeks. In the meantime, I encourage all Albertans to source their own supply of non-medical masks from local retailers, or to consider using a homemade mask when they're out in their community if physical distancing in particular is not available to them. Our government cannot supply Albertans with unlimited masks. This allotment of 4 masks should be considered a supplement to store-bought or homemade masks for Albertans. And now I encourage everyone to visit alberta.ca/masks, that's MASKS, for proper care and use of non-medical masks and homemade masks. And the sticker on the front of the mask, when people do pick them up, will also have that website available to them, alberta.ca/masks. Alberta is the first, and so far, as far as I know, the only province that has decided to distribute masks province-wide. This program will help Albertans get back to work and enjoy everyday activities safely as we all continue to work together to prevent the spread of COVID-19 throughout our province. Now, earlier today, I was pleased to see that we've now passed 250,000 COVID-19 tests that have been performed in the province. I think that's going to be a little more than 220,000 unique Albertans, because some people have been tested twice. This is a milestone. And I want to thank Alberta Health Services and Alberta Precision Labs, both of those organizations in particular, for making this province a leader in testing, not just in Canada, but throughout the world. And later today, Dr. Hinshaw, our Chief Medical Officer of Health, will be providing an update on testing for people who don't have symptoms, an initiative that will be including to expand the availability for testing to asymptomatic Albertans. And so I look forward to people being able to hear that announcement later on today. And I want to encourage any Albertan who is experiencing COVID-19 symptoms to stay home, please, isolate, and complete the self-assessment tool on the AHS website, and to schedule a test. Our collective vigilance as Albertans will help keep all of us safe as we progress through relaunch, and help also protect our healthcare workers stay safe, as today we are close to the end of National Paramedic Services Week. It's important, as our healthcare professionals are taking care of us, that we also take care of them as well. And thank you very much for listening this morning. I'm happy, Michelle, to take any questions.
Great. Thank you, Minister Shandro. We'll now go to the phones. Operator, can you please put the first caller through?
Yes, the first question is from Rafi Bouchikanian, CBC. Please go ahead.
Good morning, Minister Shandro. I guess I'm wondering what other methods were considered to distribute these masks to Albertans before you settled on these drive-through restaurants, and why did you choose this method?
Well, we chose this method, quite honestly, because these partners have access through these 600 sites to about 95% of our population. And these 3 partners are doing it without expense to the Alberta taxpayer. So the total distribution, just to give you a sense of this, I think is going to be less than $20 million for the 20 million masks that we've spent. I think it's less than $1 per mask. But then the distribution costs in total to us will be $350,000 only. And that's for us to be able to pay for the gap distribution for the other 5% or folks who may not be able to get to a drive-through even if they are in a major urban municipality. So that gap distribution, that will cost us $350,000. But the rest of this, these partners, A&W, McDonald's Canada, and Tim Hortons, have picked up the masks from our warehouse when they arrived into the province. They've helped us with their distribution, using their own distribution channels. Their employees have assisted us in with the proper cleaning procedures in packaging the masks for us as well. So we are very grateful for these partners to be able to step up and offer this service to us. So we just have to worry about the gap distribution to the remaining Albertans who may not have access to one of these drive-thrus.
Is there a follow-up question?
Yeah, it's unrelated. I'm curious to know what you can tell us about how much the government consulted with the Alberta Public Health Office about not renewing the state of emergency after June 15, because Dina Henshaw seemed quite surprised by this when we asked her a question about it a couple of days ago.
No, I think Dr. Henshaw, was just referencing the fact that the final decision is up to the Emergency Management Cabinet Committee, and that will be next week. But we have spoken, and obviously we consult with Dr. I speak to Dr. Henshaw every day, and Premier probably, I think, does as well. In fact, I spent about 3 hours with her yesterday morning, and in particular talking about the relaunch, about the public health emergency declaration. I'd remind you as well that while declaring a state of public health emergency is done by Cabinet, the Lieutenant Governor and Council, in consultation with the Chief Medical Officer of Health. The expiration of a public health emergency or termination of the state of public health emergency is up to the Lieutenant Governor and Council. But obviously we do want to continue, and we do. As I said, yesterday I spent over 3 hours with Dr. Henshaw, and this was one of the items that we did speak about. This item is going to be going to EMCC next week. But look, we have our rate is incredibly low for Alberta, something we should be proud of. The number of active cases that we have throughout the province, and even in the places where we have higher active cases than the rest of the province, I don't think there are many places where we have over 50 actives per 100,000. So I think that's a great indication of why this is why Premier was indicating that it's very unlikely, I think at this point, that the EMCC would be extending the public health emergency after June 15th.
Operator, could you please put the next caller through?
Thank you. Chris Epp, CTV Calgary. Thank you. Question and follow-up. Minister, first of all, I'm just curious how you're planning for the next pandemic. And I don't mean the second wave of this, but in the future when something hits in 3 or 4 years. Do you start stockpiling ventilators now and masks now and plot out office space? I'm assuming those discussions are happening, so you're not sort of planning as you go next time.
That's a fantastic question. And those conversations have started. It involves a few other of my colleagues. For example, Minister Tanya Furr, who is the Minister of Economic Development, Trade and Tourism. So we've spoken about what we can do. We're always going to have a supply chain that's going to be outside of our borders, but I think there's quite a bit we can do, as you said, to be able to prepare for our stockpiles of ventilators and for personal protective equipment, so that we can have more of the supply chain being included within our borders in Alberta. The partnerships that we can have with other jurisdictions on this continent, including our partner provinces in Western Canada. So I think there's a lot of opportunity there. I think we have to be thoughtful as well, as we've seen a lot of the supply chain for our pharmaceuticals be affected by this as well. I think we have to think about how our supply chain for pharmaceuticals is also going to be more of that supply chain being included within our borders, or at least more within Canada. And a big part of it as well, if you remember from 2009, the last pandemic that we saw that we had to reply to was the H1N1 pandemic in 2009. So the pandemic plan that we have in this province was updated in 2014 as a result of that. So the work is already being discussed on how we are going to be updating that pandemic plan as well. Obviously, we're still mostly focused on the current response, but you're right that we have started the conversations on what and when and what the timelines would be like for us to be able to update the pandemic plan and be able to discuss, as you said, the repatriation of a lot of parts of the supply chain for both medical devices and for pharmaceuticals. Thank you. That's a fantastic question.
Chris, do you have a follow-up?
Yeah, just related to that, given the government's willingness to enforce public health orders from stay-at-home to, mandatory spacing between people, do you also see Alberta following what some other provinces have done down the road and mandating vaccinations for kids, not just for this, but for measles and mumps and these sorts of things, as an effort to just limit the potential of those kinds of things traveling to the community, especially among young people?
So, Chris, you're asking about whether we be at this time mandating vaccination for something other than COVID?
Yeah, I mean, down the road, this is shown. What we've seen here is that the province is willing to say this is a public health order, and people are going to have to take certain precautions to protect other Albertans. Given that, and given that some provinces before all this said kids had to be vaccinated before entering the public school system for basic inoculation, so MMR, that sort of thing, is that something that the province would be willing to do down the road, given that it shows public health orders have been used and seem to have worked here?
Well, look, the Public Health Act and the various versions of it and the Public Health Act is the first piece of legislation under the Ministry of Health. The Ministry of Health is about 101 years old. The first Public Health Act, I think, dates back to 1910, so even before the Spanish flu. And every iteration, I think, dating back to 1910 has included some kind of provision like that. But I think our government has made it clear for COVID-19 that we will not be mandating vaccinations if and when vaccines become available for COVID. We made that clear. Both Premier and I have done that. And I'm not going to speak to hypotheticals about other communicable diseases, but I think we made it very clear that that's something that this government is not interested in.
Operator, could you put the next caller through?
Thank you. Ashley Joanno, CTV News.
Hi. I was just wondering, the masks that the government will be offering, are they single-use masks? I'm wondering a little bit about the quality of the masks that are coming.
Sure. So they are non-medical masks. They are triple layer, and no, they are single-use. So there are very specific directions as well. They're included on the website on how to properly put on the mask, and the sticker on the front does say, before putting on the mask, before taking off the mask, and after taking off the mask, you have to wash your hands. I think Dr. Hinshaw did say at the beginning of our response to the pandemic, her concern originally about community use of masks at that time was her concern about people not putting them on and off properly, and that could result in people touching their faces more. So that's why we're including reminders to people to wash their hands before and after putting them on and off. But they are single use. They are not medical grade masks. We are not taking away any of the personal protective equipment from our front lines.
Is there a follow-up question?
Okay, but I do. But if they're single-use masks, how, is 4 really enough per person? And what's to stop people from picking up multiple packages?
As I said in my earlier remarks, this is not meant to be able to provide Albertans with an unlimited supply. What we're saying is especially to socialize and to the issue, to encourage Albertans to consider supplying their own masks. We're going to be living with COVID, and it's going to be a part of our life for quite a long time. This is the new normal. We want to be able to help Albertans with a supply And look, people when they're not able to distance themselves in the coming weeks, we hope that's not going to be common for a lot of folks still. But at least to start off, people with 4 masks for now, and we are encouraging people to source their own masks on an ongoing basis. Government is not going to be able to give every Albertan unlimited masks on an ongoing basis, but we do want to be able to start people off with some, to be able to socialize the issue, and especially to be able to provide to those Albertans who may find themselves in situations like in transit where physical distancing isn't going to be possible to them. So that's our message to Albertans, and that's why we want to step up and be the first jurisdiction who does this for folks.
Operator, could you please put the next caller through?
Dean Bennett, Canadian Press.
Oh, thanks. Good morning, Minister. Just want to follow up on your comments on keeping Dr. Hinshaw in the loop. You were saying earlier that you speak every day with her about the situation, the relaunch, which makes me wonder then why she would not know that the plan had been in place to lift the emergency on the 15th. So it makes me wonder, were you aware when the Premier announced on Wednesday that the June 15th emergency would be lifted? And if so, and if you did know, why did you not communicate that to Dr. Hinshaw?
Look, I do. Premier and I have spoken about this before, EMCC as well, and we've been contemplating the end of the public health emergency declaration since we've had to announce it on March 17th. So we've always been aware that this was at one point going to terminate, and when would that be, and what would the conditions be? And as we look at our active cases, I think at this point here in Alberta, with our active cases continuing to decline as well, and us taking steps to reduce the number of dedicated beds in our acute care and in our ICUs, down from 2,800 for our acute care beds to 1,000 for our ICUs, down from they're down to 200 from 314. And even our dedicated ventilators down to 200 as well, and those are steps because we've been contemplating the end potentially. And look, I think I can't speak for Dr. Hinshaw, but perhaps something changes in the next couple of days with our active cases. But at this time, I think what Premier is saying is that all indication is that there doesn't seem any reason for us at this time to be contemplating an extension beyond June 15th.
Is there a follow-up?
Well, thanks. Sort of on a related one, there was also some confusion this week in terms of the Premier and health officials, well, at least outside health analysts, on whether COVID should be is analogous to the influenza. What is, as health minister, what is your definition of COVID, and is it at all the same as influenza?
Look, this stems to what provisions are already included in the Public Health Act. And COVID and coronaviruses, coronaviruses are this is a novel coronavirus, and it's novel because it's new. And this isn't something that the Public Health Act and the latest iteration of it is contemplated. So there is reference to influenza. And so if you go back to Ministerial Order 608/2020, I think it is. I think it would be Clause 2 of that ministerial order. What we had to do when I signed that ministerial order is to make it very clear that COVID was determined to be analogous to influenza at that time. So, like, this isn't from an epidemiological standpoint. This isn't from a medical standpoint. Obviously, Cabinet and Premier and I are very aware about the differences between an influenza and a coronavirus, in particular COVID. But you have to remember that this is a new coronavirus that wasn't contemplated by the Public Health Act. And from a legal standpoint, we had to tie those two together. And that, I think that's part of the reason why there's been some confusion in the media about that. But it stems from that first order. And you have to fact check me, Dean, but I think it's 608.
We have time for one more question. Operator, could you put the final caller through?
Tim Brooks, CTV News.
Hey, Minister. My first question is this week when this was brought, or last week rather, when this was brought up by the Premier, it was going to be 40.
Sorry, could I interrupt? Could you restart the question? I kind of missed. You're a little bit muffled. And maybe if you're on speakerphone, just talk directly into the phone.
Yeah, hopefully this is a little bit better.
Yep.
Last week the Premier brought this up, and it was 40 million masks that were going to be distributed. Just wondering what happened to the other half of this supply.
No, good question. So the purpose of that is that there's 2 shipments, and so the first 20 million have landed in Alberta, and we always did contemplate there being two shipments, 2 distributions, 2 Albertans. We don't want to count our chickens before they hatch, but there have been 40 that have been ordered, and so the first 20, because they have landed, they are being distributed. Well, not distributed, but they are making it their way to the 600 stores at this time. So we want to be able to let Albertans know about the first 20, and we're hoping that nothing happens with the next 20, but they have been ordered, and we hope that they arrive in Alberta soon.
Perfect. And then my follow-up here is you briefly touched on it there, and I know a full distribution plan is going to come out soon, but I'm just curious what stop people from grabbing more than one package. I mean, obviously we'll see parents and couples heading to these drive-thrus trying to get for their spouses or for their children. So what's to stop single people from going and saying they need it for other people and grabbing 6 or 7 packages of masks?
Look, this is on the honor system, and we're not asking for folks to bring in their healthcare card and get it punched to show that they've already picked up. This is on the honor system, but Albertans are responsible, and they've shown us that throughout the response to this pandemic. Albertans have shown us that they're responsible. I think that's why we've been more successful than many other large jurisdictions on this continent, because Albertans can be trusted. And so this is on the honor system. Obviously, there may be some folks who are unable to make their way to a drive-through. I'm thinking about one of my parents in particular. And whether it's me or one of my siblings who has to go pick up for my parents, that's going to be the case. And the folks at these 600 stores, the employees are going to just have to trust Albertans, and we're going to have to trust Albertans. And but I think we've seen that Albertans can be trusted throughout this pandemic, and we know that from how they've reacted so far.
Thank you, Minister Shandro. Thank you, everyone. That's all the time we have today.
Oh, sure.
Thank you. This concludes today's call. Thank you for joining. Please disconnect.
Thank you, everyone.
Thanks.